Hi, I'm Dr. Whitten. Hope you're having a wonderful holidays. And today we're going to do a very ambitious video on low back pain. The reason I say it's ambitious is because there's many types of low back pains. I can't just give you 3 or 4 exercises and hope that they're going to work for every different type of low back pain. You could have low back pain from scoliosis, where your spine is asymmetrical. You might have sacroiliac joint pain. You could have a lumbar disc bulge, which is pinching the nerves, the sciatic nerves. You could have tightness of the paraspinal muscles or the quadratus lumborum, which attaches the pelvis to the lower ribs. There could be jamming of the facet joints in the lumbar spine that are just kind of jammed together or causing inflammation and just kind of creating a little hitch, you know, when you move in certain ways. There's so many different kinds. You could have glute pain or deep pelvis pain, like in the piriformis muscles, that could trigger either local pain or referred pain. You could also have sciatica going down the leg, which could either be caused from the lumbars or from where the sciatic nerve exits the deep glute muscle. So there's all different places that could be causing pain in this area. So what I'm going to do is give you a bunch of different exercises, see which ones feel good to you, which ones feel right, which ones, like I say, feel right, they're not aggravating something. So if something's aggravating the pain, don't do it. Just skip that exercise and just kind of make a note to self. So you're going to explore your specific type of pain, see which types of movements feel good for you. So if you have really tight hamstrings, that's going to pull the pelvis down. If you have tight quadriceps or tight low back muscles, those are going to create tension and pulling on the pelvis. So basically what we're trying to do is make sure that all the muscles that support your pelvis are strong and relaxed, strong and flexible. So we're going to find out which muscles are weak, which muscles are inflexible, and try to correct those things. If you love health and wellness videos, be sure to give this video a thumbs up and hit subscribe. We're uploading very valuable information regularly. So hit the notification bell and you'll be sure to be alerted anytime we're uploading a new video. So enjoy. We'll start off with the cat-cow. This is a nice gentle warm-up exercise for the low back before you get into the deeper work. We're going to get into working the hamstrings here. The hamstrings are 3 muscles in the back of the leg. They contain the densest fascia. So tightness in these muscles can be the cause of low back pain because it pulls on the pelvis and makes movement stiff. Here you see I'm stretching with my back straight. Just go down as far as you can with a straight back. You can do it with legs together or apart, one leg at a time, or both, from standing, sitting, or kneeling. In the kneeling position, I use resistance, pulling the heel towards me as I rock back into the stretch repeatedly. This is called resistance stretching. Here we have the cross-leg hip stretch. If you're not flexible, you can sit on a pillow or yoga blocks, as I'm doing here. This is a great stretch for the hips and low back. Stretch and hold straight down the middle, then to the right and the left. Pause the video. You should hold each position for a minute or so, then switch legs, crossing the other leg in front, and do it again. But yeah, take your time with this one. It's a great stretch. Now we're going to show the psoas stretch. Here I'm showing it on the floor. This muscle attaches to the front of the lumbar vertebra. It's a deep abdominal muscle, but it actually attaches to the spine and it flexes the right leg to the opposite shoulder. When it's tight, it causes low back pain, especially when you get up after sitting. Here's a great standing movement to stretch your psoas. Start slowly, then you can do it more quickly after you get the hang of it and warm up. The right leg goes back as the right arm goes overhead, and look away, and then switch. This hip hiking is very interesting. It's actually not the side that you're hiking. Essentially, this creates traction on the leg that you're pushing away. It releases the jamming in the lower lumbars as well as the sacrum. Creates a nice little stretch in the paraspinal muscles and the deep lumbar muscles. And I can often get a little pop this way when my lumbar facets jam up. When you stretch the leg off the table, it does the same as the hip hiking, stretching the paraspinals, but it puts a little torque on it. My low back was jammed up for a couple years, and regular chiropractic moves didn't release it until I discovered this angle, and now I can manage my low back pain when I'm sitting too long and my facets lock up. You can bounce it or just hold the stretch. Also try rotating the hip in or out until you find the exact angle that gives you the best stretch. Child's pose. Here you want to open your knees wide and let yourself drop as flat as you can, sitting back on your feet. Reach out with your arms and let your shoulders sink to the floor. It feels really good on the low back as well as the hips and the shoulders and upper back. I call these the bicycle jumps. I don't know what their real name is. Once you're warmed up, this is a nice little workout. It creates a fast stretch on the quads and low back. If you're still really tight in some of these muscle groups, this may be difficult. Work to get the front leg between the hands when you do the jump. Now we're going to do some strengthening exercises. Here's some exercises to tone up the muscles that may be weak and causing low back problems. Here we see the plank, which is the push-up position but on your elbows. This strengthens the core muscles. Here's a great glute exercise. You can start off with both legs on the floor, and if that's easy, do it with one leg up. Raise your hips up as high as you can and hold it for a couple seconds at the top. Do it 10 times on one side, then switch legs. And finally, work your low back muscles by raising your chest and legs off the ground and doing a fluttered kick with your legs while your arms are out in front of you. I hope you enjoyed this video. If you do it consistently, you'll get stronger and more flexible, and hopefully your back pain will get less and less. The first thing you do is you try to resolve it with your exercises, with stretching, seeing less invasive therapists like chiropractors and acupuncturists. Western medicine should be called alternative medicine because they should be the last alternative. It's the most invasive, the most costly, the longest rehabilitation, the biggest possibility for side effects and long-term complications. So that should be the last resort. See if these less invasive therapies can help you first. If you have any questions, don't hesitate to reach out, email me if you need any more guidance. Hope that helps. Have a great holiday, and we'll see you next time.